Dear students, welcome back. In the previous session, we have discussed about ankle joint structure and its function. Now, in this session, we are going to discuss about the another joint which are related to ankle and foot complex is the subtalar joint. Okay, so the subtalar joint or talocalcaneal joint is a composite joint formed by three separate plane articulations between the talus superiorly and the calcaneum inferiorly. Okay, here the joint is formed by the talus superiorly and calcaneum inferiorly. Okay, so and in between these two bones we are having three articulations. Three separate articulations are present in between these two bones. Okay, together the three surfaces provide a triplanar movement around a single joint axis. So because of these three articulations which is present in subtalar joint, it provides a triplanar movement. That means it provides three kinds of movements around a single joint axis. Okay, functioning of the subtalar joint in weight bearing is very critical for dampening proximal rotational forces while maintaining contact of the foot with the ground. So, in the subtalar joint, we are going to discuss about its joint structure and its ligaments. And if you see the function of the subtalar joint, we have to discuss what is the axis, that is single axis, which provides triplanar movements, and also what is the function of this subtalar joint in weight bearing as well as non-weight bearing. Okay, we have to discuss both the things. Okay. Yes, now we will see the subtalar joint structure. The subtalar joint articulating surfaces are highly variable, but the posterior articulation is consistently the largest of the three articulations. So it is having actually anterior, middle and posterior articulation. So the posterior articulation is largest of the three articulations. Okay. The posterior articulation is formed by a concave facet on the under surface of the talus. So very important, just focus on this. So the talus is having a concave facet posteriorly on the underside of the talus. Okay, concave facet, as well as and it is going to articulate with convex facet of the calcaneum. So that is the posterior articulation. Okay. Next, and the smaller anterior, okay, the smaller anterior and medial talocalcaneal articulations are formed by, here the articulating surfaces are going to change in these two things. One is the smaller anterior and medial. So these two articulations will have different articulating surfaces here. So this anterior and medial will have, the talus is having convex surfaces. Okay, these two are convex surfaces, anterior and medial, and on the calcaneum it is having convex surfaces. So if you see the posterior thing, the talus is having concave facet and calcaneum is having convex articulating surface, whereas anterior and medial side of talus is having convex facets and this calcaneum is having concave facets. So these are the surfaces, articulating surfaces of the subtalar joints. Okay, so in the talus, so we are having anterior medial convex facets and posterior concave facet, which is going to articulate with the anterior and medial concave facets of the calcaneum and posteriorly convex facet of the calcaneum. These are the articulations. Okay, now the anterior and medial articulations will have an intra-articular configuration which is reverse of that of the posterior facet. Okay, between the posterior articulation and the anterior and medial articulations, there is a bony tunnel is present. In between them, there is a bony tunnel formed by a sulcus called as concave groove in the inferior talus and superior calcaneus. This funnel shaped tunnel is known as tarsal canal, which runs obliquely across the foot. Its large end, that is sinus tarsi. So here you can find the tunnel here. Okay, so it is having the large end, that is sinus tari, lies anterior to the fibular malleolus. Actually, this fibula here, okay, this fibular malleolus, in front of this you'll find this sinus tari. Okay, and it is having a small end lies below the tibial malleolus. So this one is the medial side and this one is the lateral side. The sinus tari, that is the large opening of the tarsal tunnel, we can find on the lateral side, whereas on the medial side we can find the smaller opening of this tarsal tunnel, that too which lies below the medial malleolus of the tibia. Okay, next, and it is also having a bony outcropping on the calcaneus, and it is having above a bony outcropping on the calcaneus called the sustenculum tali. Sustenculum tali. So here you can find the sustenculum tali above the calcaneum, that is on the superior aspect you can find this sustenculum tali. The tarsal canal and ligaments running the length of the tarsal canal dividing the posterior articulations and the anterior and medial articulations of the subtalar joint into two separate non-communicating joint cavities. So in the tarsal canal, the ligaments which are running throughout its length is going to divide this posterior articulation with that of anterior and medial articulation separately, and these articulations will not communicate. Okay, because of this, the structures which are passing through the tarsal canal. Okay, and then the posterior articulation has its own joint capsule. So the posterior articulation is having its own capsule. So the subtalar joint is not having a single capsule. Here the posterior one has its own capsule, whereas the anterior and medial facets, here you can see anterior and then the medial. So these two will share a single capsule. Okay, and this one is also, this capsule is also sharing with talonavicular joint also. All these three shares a capsule, but the posterior articulation of the subtalar joint is having individual capsule. Okay, Now, some of the studies by Wang and colleagues found that the subtalar articular surfaces, although smaller than those of ankle joint surfaces, showed a similar proportion of contact across surfaces under similar conditions. Okay, and these investigators found that the posterior facet received 75% of the force transmitted through the subtalar joint, and they are determined that the pressure in the posterior facet was similar to that of medial and anterior facets given the larger contact area of the posterior facet. Like the ankle joint, the subtalar joint rarely undergoes degenerative changes unless if it is having any damage to that particular joint due to fracture, like that. Okay, so this is about the subtalar joint. That means this posterior articulation of the subtalar joint is receiving 75% of the forces which is transmitted through the subtalar joint. This is a very important point. You have to keep it in mind. And also, like ankle joint, this joint will not undergo degenerative changes unless it is affected with any injuries or high stresses. Then only this joint is going to be affected. Otherwise, this will not undergo any degenerative changes. Okay, now we will move on to the ligaments of the subtalar joint. Yes, so in the ligaments, if you see the ligaments here, this one is the posterior aspect of the cross-sectional area of the subtalar joint. Okay, now the subtalar joint is a stable joint which is rarely dislocated, and it has a congruent osseous anatomy as well as strong ligamentous support. Okay, the subtalar joint receives support from the ligamentous structure that support the ankle joint also, as well as from ligamentous structures that only cross the subtalar joint. So this subtalar joint is getting ligamentous support from the ligaments which are supporting the ankle joint, as well as the ligaments which are crossing the subtalar joint. Okay. Through some of the anatomical studies, Harper described a number of structures contributing to the lateral support of the subtalar joint. Okay, so based on anatomy, the subtalar joint is getting a number of structures which are supporting on the lateral aspect. This one is lateral and this one is medial here. Okay, these included from superficial to deep. So the structures on the lateral side can be seen from superficial to deep. One is the calcaneofibular ligament. Okay, so here you can see calcaneofibular ligament and lateral talocalcaneal. So here we can't find, but just note it. So lateral talocalcaneal, that means the talus and the calcaneum is going to having a support called as talocalcaneal. Okay, and then cervical. So here the cervical ligament and the interosseous talocalcaneal ligament. So, and also the interosseous ligament. So here we can find a crural tibiofibular interosseous ligament, which is also giving support here, and cervical ligament and interosseous talocalcaneal ligament. Okay, so these are the ligaments which are giving support from on the lateral aspect. Out of this, the cervical ligament is the strongest of the talocalcaneal ligaments. So this ligament is very strong here, and it lies in the anterior sinus tarsi. So we found the sinus tarsi in the lateral aspect, isn't it? That is the large opening of the tarsal tunnel. On the anterior aspect of this sinus tarsi, we can find here. So here the ligament here we can find on the anterior aspect of sinus tarsi, the cervical ligament is present. Okay. And then it joins the neck of the talus to the neck of the calcaneum. So this ligament is joining the neck of the talus as well as the neck of the calcaneum. Okay, so for that this ligament is getting the name cervical ligament. So neck is cervical, isn't it? So that is the thing. So the interosseous talocalcaneal ligament lies more medially within the tarsal canal and follows an oblique path from the talus to the calcaneum. This is the interosseous talocalcaneal ligament. This ligament is found in the tarsal tunnel only. So here we can find the tarsal tunnel in between. This is the coronal section. So the gap you can find here, that includes the tarsal tunnel, and this ligament is placed almost most medial to the inside the tarsal tunnel, and the fibers are placed obliquely here. Okay, and this oblique path of these fibers connects the talus to the calcaneum. And divisions of the inferior extensor retinaculum. This extensor retinaculum you can also found here. So here this is the superior extensor retinaculum and inferior extensor retinaculum, and superficial peroneal retinaculum on the lateral side and inferior peroneal retinaculum. So these are also gives support to the ankle joint as well as the subtalar joint, but this retinaculum is having more effect on the subtalar joint and little support on the ankle joint. Okay, yes. Now again we'll move on to this ligaments. Okay, so these divisions of inferior extensor retinaculum also provide stability to the subtalar joint superficially. So we have seen that extensor retinaculum on the superficial side. So these are going to give support superficially as well as through connections within the tarsal canal. Okay, so the subtalar joint is very stable. Okay, and because of its support, bony supports or bony configurations, and also the ligaments like calcaneofibular ligament, cervical ligament and interosseous ligament, which gives support to this subtalar joint. On the medial side, this deltoid ligament will give support to the subtalar joint also. So these are all the structures which give support to the subtalar joint and make this subtalar joint shows that it is a very stable joint like ankle joint. Here in this joint, the dislocations are also or fractures are also very rare. In the next session, we are going to discuss about the subtalar joint function. Thank you.